Hi. So today we are going to see the next topic related with the question answers, how they will be framing based upon the client's needs. So they have given already a percentages levels with the based upon the needs of the patients as a three most important categories like safe and effective care environment, psychosocial integrity, and with the physiological needs. So this type of percentages levels with their question answers will be framed mostly in the NCLEX examinations. Even they can follow with the other prometric examinations also like DHA, HAAD, and with the MOH. So the first safe and environmental care environment, effective care environment, there are three needs is there like management of care about 17 to 23 percentages, with the safety and infection control around 9 to 15 percentages, and health promotion and maintenance around 6 to 12 percentages, and the psychosocial integrity like 6 to 12 percentages of questions can be asked from that, and with the physiological needs basis around 40 percentages totally like basic care and comfort. Related with that basic care and comfort, they can take about 6 to 12 percentages, and with the pharmacological, with the parental therapy, they can frame questions like about 12 to 18 percentages, and with the reduction of risk potentials about 9 to 15 percentages, with the physiological adaptation 11 to 17 percentages. The first point, the first need, management of care, around 17 to 23 percentages can be asked based upon the management of care, how the care has to be taken based upon the needs of the patients, how the care will be taken for the patients. So how we have to take care of the patients based upon their needs, like managing the care. So how to manage the patients. So I have given one of the examples. So with that example we can discuss this point so that you can able to understand it easily. The nurse has received the client assignment for the day. Which client should the nurse will assess first? So they have given the first option as a client who needs to receive the subcutaneous insulin before breakfast, the client who has a NG tube attached to the intermittent suction, the client who is in the second day of postoperative and he is complaining of incisional pain, the client who has a blood glucose level of 50 mg per dl and he has a complaint of blurred vision. So you are going to have a assignment for the day. You are getting entered into your hospital and you are getting assignment as of 4 clients they are been giving for you. Your nursing in charge has been giving for you, and among these 4 for whom you will be assessing first. So that is your priority. Like if giving a priority to analyze them as a priority, we need to choose the correct answer. That is a priority answer you need to choose here as a first assessment for whom you will be assessing. So as a correct answer, we need to assess the client. We need to assess the client here as a first. As the assignment for the day, the first person, the first patient for whom you will be assessing, they are asking you. So here the most priority that you have to show for the 4th person only, because the 4th patient who is having a very low blood glucose level, he is undergoing a hypoglycemia and he is also having a blood glucose level of 50 mg only, and he is also having a complaint of blurred vision. He is also undergoing a complicated conditions with the hypoglycemia, like he is been arising, he is having a blurred vision also. So that is the most serious condition where you have to show the priority needs to be analyzed here as a first client, with the 4th option is the correct answer. So this is based upon the priority wise that is being asked here. So the next point is that related with the safety and infection control, around 9 to 15 percentages of questions may be asked with this type of needs. So the examples is given here like the nurse has been prepares to care for the client with the contact precautions who has a hospital acquired staphylococcus aureus MRSA, and the client has an abdominal wound also which requires the irrigation, and a tracheostomy is also there with the patient, and he is also attached with a mechanical ventilator which requires a frequent suctioning. The nurse should assemble which necessary protective items before entering the client's room. So which protective item you will be using here for this patient, they are asking you. This is based upon the safety needs and with the infection control needs. So that's like a gloves and gown, or gloves and face shield, or gloves, gown and face shield, or gloves, gown and shoe protector. So the which options you will be going for the first priority option you can give, you can use here means. So here already he is having irrigation. You have to he is having an abdominal wound. You must need to do the irrigation here, and even the tracheostomy is also there. So he is already connected with a mechanical ventilator also. The frequent suctioning also you will be needed to do. So there is a need for having a gloves and gowns. Along with that, face shield will be the most needed thing that will be needed here, because of this irrigation, because of the suctioning, the splashes can happen in your face, in your over your body. So we need a face shield here as a most important safety needs for us, as a safety infection control precautions, as a gloves, gown and face shield will be needed here to be used. Next with the questions with the health promotion and maintenance. So among that, the 6 to 12% of questions will be asked like this. Examples is, the nurse is choosing a age appropriate toys for the toddler. For the toddler, you are choosing a appropriate age appropriate toys. So which toy is the best choice you can use for this age? Whether you can use a puzzle or toy soldiers or large stacking blocks or card game with the large pictures. So you have to think about the age period. That is mean in the toddlers around 1 year to after 1 year. That's mean within a 1 year of time you can say the newborns as a infant, and after a 1 year, after they are been crossing the 1 year, they will be entering into the toddler age. So that is till 3 years you can say. So during the time, they are based upon their growth and development, based upon their motor development, and if they, with their psychosocial, with their cognitive development, we have to choose appropriate toys which is be needed for them. So the correct answer would be like large stacking blocks we have to choose, because that is the correct appropriate toy which is being used here according to their growth and development, because they'll be getting developed during this time more with their fine motor skills and even with their gross motor also. So with to improve more with their fine motor skills, fine motor development, the large stacking blocks will be very helpful. So that way they'll be blocking, they'll be handling, they'll be holding the things, and they'll be they'll be stacking the blocks one by one above it. So that is the best toy which has been the best choice for the toddler age group. Next one is the psychosocial integrity. So in the previous classes, in the previous videos, I was been telling you regarding the regarding the Maslow's hierarchy model, which is basically based upon the physiological needs. How to give a priority for the physiological needs of the patient. How to make a priority. So to make a priority, always we have to go with this type of Maslow's hierarchy model. Only then we can able to understand what they are saying with the Maslow's hierarchy model means. So usually whenever you are taking care of any patients, we have to go from the base to that topmost level. That is from the base we have to start. That is the basement is the most important needs, like physiological needs for each and every human beings: food, water, shelter, and warmthness and rest, and even with their basic circulatory and with their respiration, everything will be coming under this. Even with the ABC, with airway, breathing and circulation analyzations and intervening, that as a first priority is also coming under the physiological needs. And after that only we'll be going with the security needs, then the belonging and the love and needs, like with the psychosocial needs and with the psychological, all those things will be coming under after that physiological only. So whenever you are going with the needs, we have to approach as a patients with the first priority has to be given to the physiological only. So based upon that only they are asking many questions. So in this also one of the example is being given here. The client with the coronary artery disease who have been selected for the guided imaginary to help to cope up with the psychological stress. How to cope up with the psychological stress you are been teaching, and you are giving them a selected guided imaginary technique also. That is one of the technique which you will be usually followed for the treatment purposes. In the psychologically, if the person has been undergoing a very stressful event, we can give this technique, and which client statement will be indicating and proper understanding with the stress reduction measures they have been given you. So the first option is been this will what statement the client would be replied to you regarding the proper understanding about this therapy, which is the correct option you have to choose here. The first option is that this will be helping only if I play music at the same time. This will work for me only if I am alone in a quiet area. I need to do this only when I lie down in case I fall asleep. The best thing about this is that I can use it anywhere and anytime. So here, based upon the using the techniques, their understanding, you have been analyzing here with their statement. So how which one would be the best, the correct answer regarding the proper understanding with this guided imaginary technique. So actually the correct answer is, the best thing about this is that he can use it anywhere and anytime. So for this selected guided imaginary technique, there is no need of any proper way of doing it. So we can involve this as a creating an image in your mind. Even by closing your eyes at any place, you can do this imaginary techniques by concentrating on any objects, and even by hearing some musics also. So that is also another one way of guided imaginary technique only. So becoming a less aware of the offending stimulus. So regarding the stimulus which has been provoking you to have the more stressful, so to get less aware of that stimulus, we will be getting concentrated with some other images or some other things by thinking of it in your mind, and even by hearing some of the musics, we can follow this type of guided imaginary technique. So that is the images is being related with this, that is a guided imaginary technique. How it has been like a programmed directed thoughts that has been guiding your imagination towards a relaxed and focused state. The third category is the physiological integrity needs. So among that, the 4 needs are being given importance. That is, the first one is the basic care and comfort. About 6 to 12% can be asked based upon this, by providing care and comfort and assistance with the clients in performing their daily activity living. And the second option, the second point is being related with the pharmacological needs with the parenteral therapy. So about 12 to 18% they can ask you with this type of pharmacological based questions, like administration of medications with the intravenous therapy, with the parental nutrition, with the blood administrations also. And the third one is the reduction of risk potential. Around 9 to 15% of questions will be asked based upon preventing the complications and problems related to the client's condition, and with the treatment also, and for the procedures. With the physiological adaptation, around 11 to 17% can be asked, like providing care to the clients with the acute, chronic, and with the life-threatening conditions. So by analyzing their physiological changes, that is being told here as 11 to 17% will be asked based upon the physiological adaptation. As an example, for the basic care and comfort, 6 to 12%, like a client who, and as an example they have given, a client who is having a Parkinson's disease, he is developing a akinesia while ambulating, so increasing the risk for falls. So which suggestion should the nurse will provide to the client to alleviate this problem? First option, whether you will ask them to use a wheelchair to move around, or second one, stand erect and use a cane to ambulate. Third option, to keep the feet close together while ambulating and use a walker. Fourth option, consciously to think about walking over imaginary lines on the floor. Actually, this is one of the problem where the Parkinson's disease, what is that you must know. So Parkinson's disease is one of the brain disorder which will be affecting the motor nerve system. So mainly it will be making a dysfunction with your motor nerves alone. So why it happens means, usually the dopamine will be produced from your brain, which is a part by the substantia nigra, which has been located in the midbrain. So from that part the dopamine will be released, but here in this Parkinson's disease, so this part will be getting affected. So the motor nerves, neurons will be getting affected here. So the dopamine release will be very less production of the dopamine will be there in this Parkinson's disease. That's why the patient is being getting affected with the motor neuron functions. So as a result of this, the patient will be showing the symptoms like this, as a stooped posture, masked face, forward tilt of trunk and back rigidity will be more, and flexed elbows and with the wrist, and with the reduced arm swing, and with the hand tremors also, with the slightly flexed with the hips and knees, and the tremors will be more in both the hands and in the legs also. And while they are walking, they will be walking like shuffling. The gait will not be in a proper way. They are like a short stepped gait will be followed. So this is like their symptoms. So in this condition, he can able to walk, but he will be having a very slow movement only, bradykinesia. as it is given in this question, akinesia. So there was a absence of movement, even freezing movement also will be there. At one point they will be standing, at one point they will not able to keep their next step also in front. So they will be like freezing, they will be standing in one place for a prolonged time. Like this way they will be not able to walk in a frequently, they will not able to have a proper frequency in their walking. So having these client, imaginary lines has to be made in front of them. They have to think like that. So continuously they have to think like about walking over the imaginary line on the floor. So like that way they have to think by themselves, they have to try to walk spontaneously, like continuously. So consciously they have to think like that, and they need to go with this walking method. So this is the fourth option is the correct answer. The next one is the pharmacological and with the parental therapy. About 12 to 18% of questions will be asked like this. The nurse example is the nurse monitors a client receiving the dejections, for which early manifestation you can see the dejection toxicity. So when the dejection toxicity happens, what are all the early manifestations that you can see here? They are asked you. As an immediate manifestation you have to say. As an early, they have given a word like early. So we must say the early manifestation, immediate manifestation, what you can see with the toxicity. They have given a first option as anorexia, second option is a facial pain, third option is a photophobia, fourth option is the yellow color perception. So whenever the dejection toxicity occurs, actually dejection is been one of the cardiac glycoside drugs which has been used to treat the heart failure, even to control the ventricular rate also. Even the patient, if the patient is having atrial fibrillation, for treat that condition you will be administering the dejections. So whenever you are administering the dejections, if the toxicity occurs, the first symptoms that will be arises from the GI system. As the early symptoms, you can see the anorexia, nausea, vomiting, and with the abdominal pain. After that only the cardiac symptoms will be arises, and with the neurological also. As the immediate symptoms, you will be having the anorexia here. So that is the first option, which is the correct answer here. Next one is the reduction of risk potential. About 9 to 15% of questions will be asked based upon this, like prevention method, like prevention of the risk for the patients by preventing the risk with the patient. So like about as an example, they have given a magnetic resonance imaging MRI study has to be that was being prescribed for the patient with a suspected brain tumor. So the nurse should implement which action to prepare the client for this study. For this test, how we will be preparing them, and what is the most important priority you will be giving here to prepare them. First option, they are telling shave the groin for the insertion of the femoral catheter. Second option, remove all the metal containing object from their body and keep the client in a NPO, nil per oral, nothing by mouth, for about 6 hours before the test. With the fourth option, instructing the client in a inhalation techniques for the administration of radioisotopes. Among this option, which would be the correct option in that way to prevent the risk, to protect the patient from the risk potential. So whenever you are going with the MRI study, that will be usually in that MRI, the magnetic field will be used. The magnetic field will be there to take a scanning of their body. So the magnetic field will be used, so whenever the magnetic field is there, that will be attracting the metal items towards it. So when the patient has been having any jewelry or something like any metal containing objects in their body, they have to remove that first. So that is the first very important option, so that way we can prevent the risk for them, like injury. We can prevent the injury risk. So yeah, usually NPO is not necessary here in this MRI. So those options will not be appropriate here. So that is a very important one option that we need to go with before going to the test, we need to instruct that to the patient. So the final point is a physiological adaptation. About 11 to 17% can be asked based upon this. One of the example is the client with a renal insufficiency. He is already in a renal insufficiency case and he has a magnesium level of 3.5 milliequivalent per liter. On the basis of this laboratory result, the nurse is interpreting which sign as a significant sign you can see here. So you must know the normal levels of the magnesium. So here the magnesium is been more than the normal level. It has been above 3 milliequivalent. Always the level should be maintained below 3. So but here is been 0.5. It has been increased than the normal level. So here the condition is a hypermagnesemia. So whenever the patient has been undergoing the hypermagnesemia, so the symptoms will be arises. So which symptom would be able to be seen here? we need to choose here. So the first option is the hyperipnea, second option is the drowsiness, third is the hypertension, fourth is the physical hyperactivity. Whenever the magnesium is been getting increased up, so this type of conditions like hypermagnesemia you can see when mainly with the renal failure cases, like acute and even with the chronic also. As I told you in this question answers, with this question, with the renal insufficiency case also you will be getting the magnesemia like this hypermagnesemia. So whenever it is been occurring, first it will be affecting our central nervous system. That means neurological depressions will be occurring. So mainly with the neurological depressions will be more, along with the respiratory depressions also. But the first symptoms you will be getting the symptoms like drowsiness. So the related with the neurological depressions, drowsiness will be there. Even sedations also, even lethargy with the respiratory depressions also will be coming along with the neurological depressions. Like muscle weaknesses will be more in the respiratory muscles, with their breathing will be getting affected. So as a first option we have to choose the drowsiness. Even other options like they have given hyperipnea, hypertension, physical hyperactivity, but the most appropriate answer with the central nervous system changes is the drowsiness. So that's all with this based upon the safety needs. So the question answers will be taken based upon these type of safety needs, like with this all these option methods with all these categories. So we can able to expect with this type of percentages levels based upon the client's needs. So this is like mainly this type of percentages level will be followed in the NCLEX examination. Even this can be followed with the DHA also, with the HAAD and MOH. So please prepare well for your examination, and I will be giving a mail also in the description. So please, if you want to get, if you need to get prepared with yourself for these examinations, we can approach us through that mail. So we will be replying to you, and we will be helping you to get prepared for your NCLEX and with the DHA and with the HAAD and MOH. So please contact us through that mail, and please mail us also. So we will be replying to you, and even the follow-up steps for the processes, how to go with these preparations, and how we have to get through these examinations will be guided from us, from our center, and from through the personnels who are being allotted here. So thank you. All the best. Crack well your examination.